Welcome to the worldwide Intraceuticals community. Our ever-growing list of clinics, day spas and medi-spas is testament to the success and popularity of the Intraceuticals treatments, products and training protocols. The following DVD is intended to guide new users through a series of protocols designed to deliver the best possible training outcomes. The Intraceuticals infusion system provides a rich concentration of oxygen for direct application to the skin as an essential component in skincare treatment. When your Intraceutical system arrives, check to ensure you have all the components. Your system package should include installation and operational CD/DVD, printed system manual, printed protocols manual, Intraceuticals oxygen system, power cord, Intraceuticals infuser, infuser attachment hose. Unpacking. When unpacking the system, take care not to hurt yourself. Open the top of the package, remove the accessory box and foam packaging. Lay the box on its back. Take the system by the handle and slide it out and stand it up. The Intraceuticals infusion system takes oxygen from the surrounding air using a specialized molecular sieve filtration system. The system provides a continuous stream of therapeutic-grade oxygen that is readily available, constantly renewable, and always reliable. The Intraceuticals infusion system eliminates the need for pressurized combustible oxygen tanks and regulators, as well as the inconvenience and costs of refilling. These highly reliable systems require little maintenance and are easy to service. More importantly, they consistently provide high concentrations of quality oxygen. Operation is simple and effective. Begin by attaching the power cord and plugging into the nearest power outlet. If your system does not have a hard-wired power cord, plug the cord into the socket at the bottom rear as shown. The front panel of your infuser system displays the 4 key features you should familiarize yourself with. The power switch. Depress the top of the button to activate the system and depress the bottom of the button to deactivate the system. The oxygen outlet. This is where the oxygen is dispensed from the system. The flow meter. The flow meter adjusts the rate of oxygen being dispensed. For the oxygen facial, the black ball should be sitting on number 5. To adjust the level, simply turn the dial either right to increase rate or left to decrease. This adjustment can only be done without the facial applicator attached. Each increment is measured in liters per minute. The circuit safety switch. In the event of a power surge or short circuit, the safety switch will pop out to avoid damage to the system. The hour counter keeps a record of the number of hours the system has been in operation. Check your operation manual for service intervals. Now we are ready to set up the system. Connected to the oxygen supply is the Intraceutical serum infuser. When attached, the infuser provides a pressurized flow of therapeutic-grade oxygen. Attach the serum infuser to the hose. This is done by screwing the bulb of the tailpiece onto the base of the infuser. Tighten it until you can no longer hear or feel any oxygen coming out. This allows the operator to dispense the intraceutical's specialized serum and oxygen-rich concentrate over the entire face, providing maximum oxygen exposure. To hold the serum infuser effectively and ergonomically, please use the following steps. First, hold your hand flat with your thumb facing upwards. Place the serum infuser with the nozzle sitting on your middle finger and the end of the serum infuser cradled in the groove of your thumb. Keeping your hand relaxed, fold your little ring and middle finger around the base of the serum infuser. Rest your index finger on the side or base of the infuser pot, leaving your thumb to rest on the trigger, enabling you to control oxygen serum flow. Now, let's have a little practice. Pop the lid off the infuser pot and pour the contents of the serum vial in. Replace the infuser cap firmly, but not too tight, as it will create a vacuum, making it difficult to remove later. Your serum infuser has two very simple actions you need to remember. Using your thumb, press down on the trigger. This releases the oxygen flow. Keeping the trigger pressed down, draw the trigger back. This will release the serum from the pot. Of course, you can regulate the amount of serum being sprayed by how far you pull the trigger back. When spraying large areas such as the cheek or the forehead, you must be approximately 5 centimeters away from the surface of the skin. When spraying smaller areas such as the eye, nose or upper lip, you must be 1 centimeter away from the surface of the skin. Draw the trigger back a little to action a fine spray and control the amount of serum being dispensed. To avoid discomfort to the client caused by stopping and starting the oxygen flow, keep your thumb pressed down at all times and simply slide back or forward to regulate the serum flow. Once you have completed spraying the area, gently guide the tip of the infuser to 1 millimeter from the surface of the skin where you have sprayed to commence infusion. To summarize the treatment, it's a continuous process of spraying and then infusing the serum. Remember, it is essential you clean the serum infuser after every treatment. Finally, some critical points to remember. The system requires approximately 5 minutes to achieve the correct oxygen level. The facial system draws in ambient air through the filters on the side of the machine. Ensure you leave adequate space around the side filters of the facial system so that air can be freely drawn in. We recommend you do not place the sides of the facial system against a wall or any object that will block airflow from entering. After treating each client, it is essential that the infuser be cleaned thoroughly. First, rinse the infuser in warm water or under a warm tap to remove excess serum. Run water through the infuser. With the trigger pressed down and drawn back, spraying water through until it is clear. Use an alcohol wipe to clean out the tip of the infuser. Never insert a cotton bud or anything stiff into the tip of the infuser, as this will bend the fine needle slightly protruding and prevent the infuser from spraying effectively. Use a sterilizing solution to complete the cleaning process, especially if you have treated an open wound or infected pustule. You may remove the end tip of the applicator and sterilize the tip in an autoclave if available. The infusion system requires only limited maintenance. Once a week, please remove the black filters located on the left and right side of the system and wash the filter with soap and warm water. The mobility and compact size of the system allows you to store it under a table, in a closet, when it is not in use. As simple as that. But remember, please familiarize yourself with these procedures. Also, consult the Intraceuticals Treatment Protocol DVD and manual prior to professional use. We recommend you make one member of staff your product champion so that if difficulties arise, that person will be able to solve most problems. I can't stop serum from spraying out. Screw off the back of the infuser. Loosen the clamping nut. Pull the needle out a little. Twist it around a few times. Then push it in and out a few times. Now push it in until it stops. Tighten the clamping nut and replace the back cover. I cannot get serum to spray out. Remove the hose from the infuser and check that the flow meter is set to 5. Reattach the infuser. Check that the hose is securely attached to both the system and the infuser. Check for leaks. Follow steps as previously to clean the needle, except pull the needle all the way out. Use an alcohol wipe to clean off any dried serum residue. And then put it back in. Push it till it stops and tighten the clamping nut. Replace the back cover. As simple as that. But remember, please familiarize yourself with these procedures. Also consult the Intraceuticals Infusion System Operations Manual. For contact details, please visit intraceuticals.com.